government has issued a health advisory as influenza cases continue to rise in the national capital, with H1N1, commonly known as swine flu, emerging as a dominant strain. Delhi has reported more than 2,600 influenza cases this year. The health department has urged residents to maintain respiratory hygiene, avoid crowded places, and seek timely medical intervention. People have been also advised to cover their mouth and nose while coughing or sneezing and wash their hands regularly with soap and water. The advisory also recommends wearing masks in crowded places and avoiding close contact with people suffering from respiratory illnesses. Residents have been asked to avoid unnecessarily touching their eyes, nose or mouth, avoid spitting in public places and maintain adequate fluid intake. Those experiencing symptoms including fever, cough, sore throat, breathing difficulty, body ache and headache have also been advised to seek medical advice promptly and avoid taking any medicines without consulting a doctor. Hospitals have been equipped to manage the seasonal rise in cases, while daily monitoring of influenza-like illnesses and severe acute respiratory infections are currently underway. I have my colleague Pragati to get us more details on this. Pragati, influenza cases are on the rise. A detailed advisory has also been issued by the Delhi government. What all preparatory measures are being taken on part of the authorities?
Yes, there's a sharp rise in seasonal influenza cases, with H1N1 emerging as the dominant strain among influenza A infections. And according to the latest health department data, Delhi has recorded around 2,602 influenza cases this year. Of these, 2,392 are influenza A cases, including 1,777 H1N1 cases. And on a single day, 159 fresh influenza cases were reported, of which 114 were H1N1. And if we, the current rise is being reported across Delhi and wider NCR region and comes amid the monsoon season. Doctors say seasonal changes, humidity and increased circulation of respiratory viruses can contribute to a rise in influenza infection. There is no indication that a new strain of H1N1 has emerged. The concern is sharp increase in the number of infections, and the numbers show the scale of that increase. Delhi had reported around 2 to 9 H1N1 cases during the corresponding period last year, while this year the figure has climbed to 1,777. And Delhi Health Department has set up surveillance monitoring influenza-like illness and severe respiratory infections on a daily basis. Hospitals have been alerted and their preparedness is being reviewed, including availability of beds, critical care facilities, testing arrangements, and essential medicines. And at the center, Union Health Minister JP Nadda has also reviewed the situation with health officials. The review has
absolutely, Pragati. A detailed review is being done by the center government as well. Let's slip into a very short break. Don't go anywhere. Much more on the other side.
वो वाली AMD